The challenge with this surgery, of course, is that it's almost a case of gigantomastia, meaning an extremely, extremely large and heavy breast. You will receive general anesthesia for the procedure. We will start by placing a small IV access in a vein in your arm. Then you will receive the appropriate medications. These will make you feel like you're falling asleep, but you'll actually be a bit deeper under. That means you won't be aware of anything from that moment on, of your surroundings. You won't feel any pain and you'll be well relaxed. We'll be there with you the whole time to make sure you're comfortable, and you'll be closely monitored. And then we'll get started right away after you've gone to sleep with the surgeon. That is, with Dr. Schumann. My hands are a bit cold. It's already very difficult for you as well. Yes, that's right. It's a lot of weight. So here too, I'm rotating the breast back upwards. It needs to be straightened a bit. It needs to be a bit bigger. That would be it for the drawing. Then you can actually go ahead and get into your little OR gown. Okay, the challenge. With this surgery, of course, we're dealing with a very, very oversized, excessively heavy breast with a significantly descended nipple areola complex, as we call it. So the areola and nipple complex is very far down. It has sagged downward in this patient. We need to bring that back up by means of what's called a pedicled flap technique. We try to perform the entire operation as gently as possible. I'd say I'll go scrub in now and then we'll get started. We're just about to remove a C-shaped segment of breast tissue here. That's the characteristic feature of the whole Fendley method. And we're going to remove it in one piece right here, and then we'll weigh it. Then we'll see where we stand, and after that we'll need to do some fine-tuning. This is actually a pretty bloodless procedure. That's simply because we've programmed our radio frequency devices here so that we can cut with very little bleeding. And that's why we can do without drains in most operations. Here we might put in drains for a few hours. But as a rule, I would say that in 99% of patients, we don't need it. Now about an hour has passed and the first breast has basically already been reduced. We've now removed a total of probably around 600 grams. The breast will now be reshaped using what's called pillar sutures. But we'll only do that once we've treated the other side as well so that we can achieve the best possible symmetry. Muscle doctor, you look good. 3-0 suture. Now, using what's called pillar sutures, we're reshaping the mammary gland anew. And in a way, we're stabilizing it from the inside, so we're not dependent on the skin, as is the case with many older methods where simply a cone-shaped part of the lower breast is removed. And then the skin is stitched together, and the skin is supposed to hold everything in place. Of course, that doesn't work. Here you can see again the charm of this half-Feindel method. The breast gets a beautiful projection, and now it almost looks as if there's a small implant inside. But that's just the reshaping of the mammary gland using this elegant technique from the wonderful Elizabeth Rolfe Hindley from Canada. Sending greetings for sure. Many thanks for this innovative, beautiful method, which, by the way, we've been using for about 15 years, so it's not exactly new for us. That's it. In total, we've removed over 1 kilogram of breast gland tissue. I hope this will bring the patient significant relief. In any case, she doesn't have to stay with us today, but can be discharged without drains. And with that, I'll wrap things up for now. The patient will now be taken care of a bit more, get a bandage, and then go to her room for now. Okay?